So what is ozone therapy? So in ozone therapy, it's a treatment that uses medical grade ozone gas. And the gas is made up of 3 atomic oxygens, as denoted by O3, whereas oxygen gas is O2 and is made of 2 atomic oxygens. Sorry, just getting used to how the slides are working. So the properties of medical grade ozone gas, well, it is a highly reactive oxidizing gas. It has a half-life of 40 minutes at room temperature, which relates to if you have a concentration of ozone gas in the room with you at 10 micrograms, after 40 minutes, it will be halved. And so it will become 5 micrograms, and another 40 minutes will become 2.5 micrograms. So ozone therapy is not stable at room temperature. It will break down. And this process happens every 40 minutes. What we have when we produce ozone gas, medical grade ozone gas in the clinic, we are not producing 100% ozone gas. We are actually producing a ozone gas mixture, which is 95% oxygen and 5% ozone. This form of ozone, medical grade ozone gas, is the purest form of ozone gas, and it's the only form that should be used for therapeutic applications in the field of ozone therapy. So the key question is then, is medical grade ozone gas a medical drug? Well, we use the definition of medical grade ozone gas as a term to describe the purity and the grade and the quality of ozone gas used in ozone therapy. It does not imply that medical grade ozone gas is a drug or has been classified as a drug or a therapeutic within the UK or by the MHRA, which is the Medicines and Healthcare Products Regulatory Agency. And this is a kind of a keynote here. The official line from the Department of Health, the NHS, and the GMC, and all do not recognize any therapeutic quality of ozone therapy and do not recognize medical grade ozone gas having any therapeutic property. However, there is some arguments being put forward that some applications of ozone therapy may be therapeutic. As far as I'm aware, that only implies one type of treatment. However, there is a treatment which is known as major autohemotherapy, where we take a small volume of blood out, treat it with ozone, and reinfuse it back. This is sometimes referred as a therapeutic, but this is not actually accurate, because if you were to just take blood out, 50 mils of blood out, and then reinfuse it, it would have no therapeutic benefit. We only see the changes of the therapeutic qualities change when we add the ozone into the blood. So the GMC do not enable medical doctors to treat any form of condition or disease with ozone therapy. So we cannot say that we are going to treat a patient with cancer or with COVID, for example, but we can treat the well-being of a patient to improve quality of life or general well-being, even if they do have cancer or COVID, as an example. And this is the sort of restrictions we have, particularly in the UK, compared to other countries that are more progressive in using ozone therapy. But because of this, and because they don't recognize it, and we are restricted by what certain regulatory bodies and professional bodies do on the medical profession, we are restricted to what we can say and what we can do with it. So that's why it's important not to assume that medical grade ozone gas is a drug. So how is ozone gas made? So with this diagram here, we're it's just simplifying the basic principles of how ozone is generated, whether it's in the atmosphere or whether it is in an ozone generator unit. The principles that apply here are the same. So we need a high energy source. Now, the high energy source could be the UV light within the sun rays. It could be lightning from a thunderstorm, or it could be the energy input from an ozone generator unit. The high energy source is required to break up the bonds in the element oxygen. And in so doing so, we split the element oxygen and we get two atomic oxygens coming off. The atomic oxygens are also free radicals, are highly energized and highly reactive, which means that they don't hang around very much, but when they do connect with another oxygen, so we have O2 and then we have a atomic oxygen coming in contact with an oxygen, we get O3. There will be atomic oxygens reforming with another atomic oxygen and forming oxygen again. So this is how the production of ozone is generally generated within the upper atmosphere. The only difference in the upper atmosphere is that in the stratosphere, the temperature is at 0 degrees C. And at that temperature, ozone is stabilized. Even though ozone is a highly energetical element in itself, and as mentioned before, it has a half-life at room temperature, at 0 degrees C, it is stabilized, and hence why the ozone layer exists in the position it does within the atmosphere. So the question is then, is ozone toxic? It's dangerous. This is sort of things that you tend to generally hear from the media about the toxicity of ozone in relation to possible ozone treatments. And there is a truth to it, but there's also a misdirect to it. Ozone is classified as an irritant, and the areas that we have to be careful of when ozone gas is around is the lungs. And the reason for that is that the lungs have alveoli, these bubble sacs that enable gaseous exchange for oxygen and carbon dioxide. And because the walls are very thin on the alveoli, they have very little antioxidant enzyme capacity to protect from highly oxidative stress produced by the ozone gas. And therefore, they are susceptible to damage from oxidative stress. And hence why it is not a good idea to breathe in ozone gas. Now, depending how much ozone gas you breathe in, you may have a slight cough, or you'll start to get a cough and a tightening in the chest. And if you have way too much, it is possible that you can die from ozone gas toxicity. However, in the field of ozone therapy, our instrumentation, our medical devices that we use are all readily made with ozone destructors, so that no ozone is released into the clinic room or into the atmosphere. And we do procedures so that ozone is prevented from actually entering into the clinic room. So when you go for an ozone therapy treatment, you should never really smell ozone gas at all. So in relation to ozone gas affecting the lungs, the other type of ozone gas is tropospheric ozone. And this ozone is a result of smog, which is generally found in larger cities, urban cities, where you have a lot of industrial waste gases, car fumes, etc., being made. and you have sunlight in the mix to it. As a result of the sunlight and smog reacting together, it produces a byproduct, which is the tropospheric ozone. And this is what actually causes more problems as it's more closer to the ground in the troposphere. So our exposure to ozone here is much more accessible than compared to the stratosphere. And this is why this causes problems for those who have sensitivities, respiratory sensitivities or comorbidities for the respiratory system, or people who have asthma, and they are more sensitized and will feel the effects of tropospheric ozone. So this should be also avoided. Now, when we apply ozone in the field of ozone therapy, there are what we call scientific approaches. And around the world, there are different types of scientific approaches when using ozone therapy. So in the UK and in Europe, all our practitioners are taught what the scientific approach is called the low dose concept. And the low dose concept is a methodology whereby a specific range of low concentrations of medical grade ozone gas is used, and the dosage of that gas is used. So the dosage is relative to the volume of gas used, where the concentration is, whether you use 1 or 40 micrograms is the concentration, the dosage is the volume. So atypical, for a treatment called rectal insufflation, you may use a ozone concentration of 20 micrograms, but the volume of gas that you will use for that treatment may be between 150 to 300 cc's of gas. So what we have here is a relationship between concentration and volume. We do a calculation, and that will give you a working concentration. That means when that enters the body through the colon, the working concentration is actually the concentration that's working on your body, not the concentration just that you take from the ozone generator. This is the methodology that we use for the low dose concept. And so within these parameters, we have seen when using medical grade ozone gas that medical grade ozone gas act as a bioregulator. Now, as we increase the ozone concentration, or we use higher concentrations above the therapeutic range, the bioregulation that we observe becomes blocked at higher concentrations. So the higher the concentration, the less therapeutic ozone becomes, the more degenerative it becomes. The lower the concentration of a medical grade ozone gas we use, the more therapeutic qualities we see. And this is particularly defined within the methodology and the peer review research for the low dose concept. And the low dose concept now has almost been going for a good 20 years within Europe. So as I said before, in other parts of the world, they have other schools of thought in the field of ozone therapy. So interestingly enough, in Russia, they use a very low dose methodology. And so they're using dosages between 1 and 10 for their treatments, which is very low when you compare it to the European, the low dose concept. So what I've described before for the low dose concept, the therapeutic reference range is between 1 and 40. Whereas in America, they tend to lean towards higher dosages. Not to say they don't use low dosages, but they tend to lean towards using more higher dosages. And for us in Europe and in the UK, higher dosages means anything greater than 40. So atypically in a treatment called major autohemotherapy, as I described before, maybe we take a small volume of blood out, maybe 50 cc's, and then add your ozone gas concentration to that. For the low dose concept, we would probably on average use 20 micrograms of ozone gas concentration, whereas in America, they may use 50, 60, sometimes 70. micrograms of ozone gas. So this would not be the methodology we would apply in Europe or in the UK. And so these are the three main schools of thought of how ozone therapy is applied. And I feel that they all have their place, but I think in my experience, the low dose concept seems to drive forward the expectation and outcome, meaning that the expectation and outcome are in parity when using the low dose concept. I haven't had experience in using very low dose in the Russian school of thought, but in the American school of thought, there are some areas where high dose ozone concentration is used, but not for blood work. Okay, I would mainly use it for a dermal application, not a blood application, a systemic application. So within the low dose concept, yeah, we're using a systemic application, meaning systemic, meaning that we're putting ozone into the blood and it's covering the whole blood circulation. And the therapeutic reference range for systemic applications is between 1 and 40 micrograms. And so, as mentioned before, the greater the ozone concentration above 40 micrograms, once we enter into the high concentrations, then progressively it reduces the therapeutic qualities, and then as a natural consequence becomes more progressively degenerative within the biological system. And this is why we tend to avoid it when using the low dose concept. We see that as we use concentrations above 40, we start to see more degenerative processes occurring, even though there's some therapeutic effect happening, but we wish to avoid that completely. And we, within the research done within the low dose concept, up to 40 achieves no degenerative response. And once you start going above that, these metabolites that start to degenerate the biological system are observed. However, in the dermal applications, this is dermal meaning that we place ozone onto the skin, or ozone is applied to go through to the skin. This would be in a application like limb bagging or ozone cupping, strategic areas, or even dermal application would involve also the ozone steam sauna, but we would never use 80 micrograms in an ozone steam sauna. But for dermal applications, it has a place. So we're able to apply higher concentrations because the skin has a higher tolerance to deal with higher concentrations of medical grade ozone gas as opposed to blood. Blood doesn't. What this does is it enables the practitioner to directly treat the skin that has wound infections. Yeah, so if you've got a bacterial infection on a wound that's not healing well at all, we can use high concentrations of medical grade ozone gas, and this is typically around the 70 and 80 microgram range. And at that high concentration, it literally will just oxidize and kill the bacteria. And thereafter, once that process has been completed, we can then reintroduce a modulating dose, which is a much lower ozone concentration, which is at about 20 micrograms, between 20 and 30. And that would activate wound healing. Yeah, so we can actually sterilize the wound. We can also kill the bacteria at the same time. After that process has been completed, we can then reintroduce a low dose around 20 micrograms to actually stimulate and activate wound healing. But this is the area where high concentration in the dermal application. The other area where we use ozone, medical grade ozone gas a lot is in medical grade ozone gas injections. And the therapeutic reference range here is between 1 and 20 micrograms. Now, typically, that the reference range is between 1 and 10. However, depending on the frequency of treatment happening that's occurring within the protocol, you may see a certain tolerance being built up within the biological system, and therefore we would slowly increment beyond the 10 microgram to ensure that we still generate a transient mild oxidative stress on the system. With injectables that we do, let's say for typically for Ozone Therapy, it would be within the dermis or subcutaneous tissue or even muscle tissue, nothing beyond that. And this is why the reference range, the therapeutic range is lower. If you were to use higher concentrations like 30 and 40, you will find that your patient would be complaining of pain from the injection. But at these low concentrations, the irritation or the pain is actually very minimal or none at all. And so this works very well. And the medical grade ozone gas injections also work very local level, depending what you're treating. So how does ozone therapy actually work? So I've mentioned before with the low dose concept that ozone therapy induces a transient mild oxidative stress. And now you may say, well, isn't oxidative stress a bad thing? Well, oxidative stress is a bad thing depending how much and how intense and concentrated it is. But the point is with ozone therapy, we are precisely measuring the ozone concentration within the low dose concept to induce a very mild oxidative stress. And what we have found in the peer-reviewed research over many years is that a transient mild oxidative stress will actually proliferate a number of products that have actually beneficial effects. So as a consequence, for example, when medical grade ozone gas makes contact with blood, there's an immediate proliferation of reactive oxygen species. And yes, reactive oxygen species can be harmful depending on the concentration of reactive oxygen species being produced. But don't forget, we are producing a transient mild oxidative stress here. So we're being very measured in the amount of reactive oxygen species being produced. And then we have biomessengers. Typically, a biomessenger is hydrogen peroxide. Some of you may be familiar with that. But this is actually a biomessenger. It goes off to then signal to different cells to activate or regulate certain functions. We have bioregulators, and then we have another product which is called lipid oxidation products. All of these together have the properties to activate and modulate a range of biological systems, which we will discuss. So when we are looking, in general at the biological system, blood plasma is part of the biological system. Parts of that involve the cell membrane. There's a lot of reactions initially take part within the cell membrane. We have the red blood cell that is quite actively involved with ozone therapy. We have the degeneration of pathogens. This is within the biological system. There are many enzymatic processes involved, but to name a few, glycolysis, the Krebs cycle, and the pentose phosphate cycle are all involved and are utilized within ozone therapy. All immune cells are affected in one way or another through ozone therapy. The production of biomessengers, immune messengers, are part of the biological system, and the antioxidant enzyme system is upregulated. The antioxidant enzyme system is not in relationship to antioxidants that we get from vitamins and so forth. It is a completely separate system, of which we will go into a little detail. So when we apply ozone into the blood or plasma, as we mentioned before, we see reactive oxygen species. This is ROS for ROS, and then lipid oxidation products, LOPS. We then see a series of targets, which are either the red blood cells, erythrocytes, or an immune cell, which are leukocytes or platelets. And then you can see what kind of influence ozone therapy has on those particular cells. Here we see for the erythrocytes an improved oxygen delivery. And that's, in general terms, the description of ozone therapy is, that it boosts your oxygen. It doesn't actually generate oxygen in your body. It never will do. But what it will do is improve the delivery, the release of oxygen that is bound to the red blood cell. It will improve how that is released into the body. So it won't actually increase oxygen in your body per se, but it will improve the oxygen delivery, and that's a much more that has more of an impact than just having more oxygen in your system. When oxygen is bound to hemoglobin, that oxygen is not doing anything. It's dormant. It's only when it's released that it actually has an effect. And so with the leukocytes, we see with reactive oxygen species coming in contact with leukocytes, it actually triggers a immunoactivation. And then when we see reactive oxygen species coming in contact with platelets, we see these autocoids and growth factors. And so, autocoids are like biomolecules that are similar to hormones, but they're only, when they're produced, they're only around for a brief period of time, and they're only produced at the site where they are synthesized. So they're pretty transient in their activity. And the other area for platelets is that it produces growth factors. And so what we get from the growth factors are a range of cellular processes, which include cellular regeneration and tissue healing. So you can see already the benefits just of the reactive oxygen species. Now, reactive oxygen species, when they are produced upon contact, are gone like in a millisecond. They are made, their function is performed, and they are gone. They're used up immediately. Whereas the lipid oxidation products, they hang around for a lot longer. They can hang around for up to 28 days. However, in order to achieve LOPS to maintain this period of 28 days, you need to achieve what we call a pharmacokinetic saturation, which means you need an accumulative amount of ozone therapy treatments so that the LOPS reach this pharmacokinetic saturation, which then it will maintain a certain level of effect on the patient. And so here we see LOPS generally affecting, the endothelium, and this activates the increased release of nitric oxide. Let me just, nitric oxide, which is involved in expanding the blood vessels, increasing blood flow, and decreasing plaque and blood clotting as a property. And then we've got the bone marrow, and as it says here, we have a generation of super gifted erythrocytes released from the stem cell. So what does super gifted erythrocytes mean? I think in a simple term, it's like the stem cells are able to produce red blood cell 2.0. Yeah. What we have here is a process which was an in-depth study done by Professor Bocci, who showed that when we look at the lifespan of a red blood cell, it's about 120 days, about 4 months, yeah, and then it dies. And then we have the stem cells producing more fresh red blood cells. What was started to be observed when certain research was done over this time period, that the predecessor red blood cells, would have a certain level of antioxidant capacity within them. When the second generation or the third generation of red blood cells were being made, the antioxidant capacity had increased, and therefore and other properties within the red blood cell had increased, and which Professor Bocci then labeled these red blood cells as being super gifted. So you would need long-term ozone therapy treatment to achieve this, but it wouldn't be an intensive ozone therapy treatment. It would be a treatment that would involve a maintenance level. So you would have your initial treatment protocol, and then you would tailor off to a maintenance dose, and you would continue this maintenance dose. And as you did this, you would be enabling the bone marrow to utilize, to keep receiving the information from the ozone being translated to the stem cells to actually generate an upregulated, if you like, or super gifted erythrocyte 2.0, meaning that they have, basically, because they have a greater antioxidant capacity, it means they are far more tolerant to face free radical insult. So this is something that I thought was very interesting property to be observed. Now, with the other organs, with OPS, we see an upregulation of what we call OSP, which is oxidative stress proteins. And when we have this upregulation of the oxidative stress proteins, it actually induces a trigger for upregulation for antioxidant enzymes. Okay. Now, this is a very important aspect because you can see ozone tolerance there. And so what happens when we are giving a protocol to a patient, it won't be that we'll just keep using the one concentration throughout the whole protocol. We do have to increment it because that mild oxidative stress still has to occur each time we do an ozone treatment. When the ozone tolerance starts to become more obvious with the symptom analysis with the patient, then we start to increment the ozone concentration to keep inducing this mild oxidative stress. So we're now coming into the main areas, the main four properties that medical grade ozone gas induce. And as mentioned before, the antioxidant enzyme system. And the key thing about the antioxidant enzyme system is that we as human beings on this planet, are in an atmosphere where we have 20% or 19% oxygen. If we didn't have the antioxidant enzyme system, we would have a difficult time living on this planet. And the antioxidant enzyme system have a series of different proteins that are involved in a catalytic transformational reaction when it comes in contact with reactive oxygen species. And they produce byproducts that are more stable, non-toxic molecules, and therefore representing a very important defense mechanism against oxidative stress induced cell damage. Yeah, so when we're having free radicals, hitting the red blood cell, for example, if it's a lot, then it will induce cell damage. Yeah, when we have the a healthy antioxidant enzyme capacity, that is inhibited. It is neutralized by the antioxidant enzyme system. And so what we see with ozone therapy is that it increases the antioxidant enzyme capacity of the body and therefore protects and prevents cellular damage from free radicals. And so we have this relationship with the antioxidant enzyme system, and the relationship is between the antioxidant enzyme capacity as a whole and the body's ability to also regenerate the antioxidant enzyme system. If either of these are under par, we will start to see the effects of what an insult of free radicals start to have on our system. A very extreme process that practitioners may observe in their clinic is, for example, when a cancer patient is having chemotherapy. So when I look at chemotherapy in an overview, it is a treatment that is a high impact free radical insult to the body. That's bottom line what it does. As a result of that, we have a certain amount of adverse reactions that the patient will experience because of that. So if a patient was to come into the clinic and say, I'm having chemotherapy, one of the strategies that we can use is that we would give ozone therapy 24 hours to 48 hours before the chemotherapy was being induced. And by doing that, we then increase the antioxidant enzyme capacity, and not just a little. So the patient then goes in to have their chemotherapy, and if it's the first time they're having the ozone in this way, what you'll see is that they will tend to tell you that they felt a bit nauseous while having the chemo, but nothing like before without the ozone therapy. They would feel okay enough to walk out of the hospital and get in the car without throwing up, and then when they get home, they're able to go to the toilet on their own. But generally, the effect of the adverse reactions that they normally would experience would be reduced to a factor of about 70 to 80%. Then we go 5 days or 7 days later for the next cycle of chemo. Once again, we will introduce ozone therapy to the body 24 hours or 48 hours before chemo is induced. And this time, a little more of an cumulative effect will occur, and which means that the type of feedback that I get will be that the patient will go in, have their chemo, a little bit of nausea, but other than that, they come out, they are able to go shopping, and they see their friends for coffee, they go home, cook a meal, and they have the stamina to stay up much later at night. And this is not unusual, but what we're doing here is actually not treating the cancer, we're actually supporting the body against a very high impact free radical insult. And when using ozone therapy in this way, and in increasing the antioxidant enzyme capacity, we do protect and prevent cellular damage and adverse reactions from occurring from free radical damage. Yeah. So we've talked about this relationship. We've talked about us on Earth having an atmosphere of 20% oxygen, and hence why we inherently have an antioxidant enzyme system. Otherwise, every time we start breathing, we would be having a certain level of oxidative stress, and this would be causing free radical insult and damage to our body. And so therefore, as a natural consequence, our biological system has an inherent ability to counteract oxidative stress from the act of breathing air, and hence why we don't die. But this system, the antioxidant enzyme system, and how it is affected just where we breathe, this pathway, it pre-exists. And so it's not a big jump to see why ozone would start to have an activation under controlled therapeutic ozone concentrations, medical grade ozone concentrations. And I'm just trying to get you to see that this is a relationship because it pre-exists. It's not a huge jump that we see ozone therapy having such a powerful effect, especially with um, activating the antioxidant enzyme system. And this is very key of why, we have ozone therapy being a natural therapy with little side effects. Um, and, because our bodies are already inbuilt to deal with a certain level of oxidative stress. So when we induce a mild transient oxidative stress, the body has the capability of dealing with it, but also as a result of the products being released from reactive oxygen species, we start to induce biomessengers and bioregulators that actually start to um, upregulate biological systems. And one of those biological systems is the antioxidant enzyme system. So when we look at the second property, we generally hear about how medical ozone will affect the immune system. With the immune system, as a result of similar activity, meaning due to the production of reactive oxygen species and secondary messengers, and the LOPs, the lipid oxidative products, the release of these will activate certain immune cells to release cytokines. And cytokines will then go off to activate other types of immune cells to produce a certain function. And therefore, the inherent beauty of ozone is that it has the ability to activate and also the ability to modulate. So when we have a suppressed or under par immune system, ozone has the ability to boost the immune system or upregulate the immune system. When we have an autoimmune scenario occurring in the biological system, that means an immune system that's overactive. And we have also the ability to produce modulation, biomodulation in the immune system, which means that it can then stop the autoimmune system from overreacting and then bring it back into balance in general terms. What amazes me is that, we have ozone therapy that has the ability to do this without any adverse side effects or reactions. And there is no pharmaceutical drug on the planet that has the capacity to do this at the same time, both modulation and boosting. Yeah. Without, and if it did exist, you can probably guarantee it would have some detrimental adverse reactions to it. But this is what we observe from the low dose concept of what it does to the immune system. And it's the production of cytokines that are being activated as a result of the reactive oxygen species and the LOPs being produced. And so this is another area where I wanted to actually make a relationship of systems that already pre-exist. Because to me, the human body has a certain intelligence, and I try to work with ozone, medical grade ozone, as a form of information that the body's intelligence can metabolize. Yeah. And so when we look at a relationship of pre-existing components within the biological system, we see this within the white blood cell, and specifically macrophages and neutrophils, which contribute towards the innate immune system. And after the last 2 years, the innate immune system should have been ringing bells for most people who are understanding the effect of an experimental therapeutic, which actually switches off or suppresses the innate immune system. In the innate immune system, within the macrophages and neutrophils, we have a process that can occur. It generally occurs when a macrophage or a neutrophil comes in contact with a bacterium. And when this process starts, it's called the respiratory burst. It's a process known as phagocytosis. And the respiratory burst is a rapid release of reactive oxygen species and superoxide anions, which is another form of reactive oxygen species, and hydrogen peroxide from different cell types. So, what I'm trying to demonstrate here, we're seeing products being produced naturally already within our own immune system that are in parity to what would be produced if I was to put a medical grade ozone gas into the blood at therapeutic dosages. And there's this disparity here, which means to me that there is a level of intelligence that already exists within the body that recognizes when ozone is introduced into the body, through these processes. And so when we look at the respiratory burst, the phagocytic process, the respiratory burst, is a vital subsequent degradation of internalized bacteria or pathogens. And this is important for the aspect of the innate immune system. And this is what I'm mooting before, that it inherently produces similar transient mild oxidative stress to kill pathogens. And so these are interesting co-relationships that we already have in our body within the immune system and within the antioxidant enzyme system, which explains why ozone therapy has a certain pathways that it can actually be incorporated that already pre-exist in the biological system. So the third property that is affected by medical grade ozone gas is within the red blood cell. And here we see an improvement of peripheral and microperipheral blood circulation, and promotes the increase of unbound oxygen to all cells, tissues, and organs. So that's a real plus here. That's what's the improvement of oxygen delivery means. The other factors are that it upregulates the red blood cell metabolism, and therefore ozone increases ATP production. This is the energy required by the red blood cells. So if you were to count the amount of red blood cells in the body, and you're having regular ozone therapy treatments, you, as a natural consequence, are going to start upregulating the amount of ATP. It's no surprise then that you will start to see a shift in how your energy is being managed, and how your level of stamina is going to be changed. Your quality of stamina will be changed. And this is due to the red blood cell metabolism. It also affects rheology. This is of the red blood cell. This is how the red blood cell can become more flexible. It can be squeezed, bent, or twisted, and more aggressively, and which means that blood then can go into the most narrowest microcapillaries, and therefore improving overall blood circulation. And so this is another major property of medical grade ozone. And so just to recap, we've seen improved oxygen release, improved blood circulation, increased flexibility of the red blood cell, and also increased ATP production. Now, as a result, we're getting more oxygen to the major organs, and then we're also having more oxygen being actively involved in metabolic functions at a cellular level. So when we come to the last main property, which is pathogens, we have to sort of categorize it in two parts, because the way medical grade ozone gas can act, as we've described before, is that we have dermal applications that can use higher ozone concentrations, but when we use systemic applications, we can only use a certain therapeutic range between 1 and 40. So when we're using dermal applications, we can use this 80 microgram concentration, and this is where we see really the full effect of the highly oxidizing effect of ozone. When we use medical grade ozone gas, when it comes in contact with a pathogen, the pathogen, most pathogens do not have an antioxidant enzyme system, so they do not have any tolerance for ozone or oxygen, to that matter. And so what then happens is that the cell membrane of the pathogen is then disrupted, it's broken, and then the ozone continues to enter through to the pathogen processes, which then reaches the nucleus membrane. And when that's disrupted and broken, then the DNA and RNA is also disrupted by the oxidation properties of ozone. And the pathogen has no way of surviving or even to replicate. And that generally happens immediately when you do something like limb bagging. However, in vivo, meaning when you do it in a live biological system, we have to use the other processes, which are the productions of reactive oxygen species and lipid oxidation products that produce a reaction that we see that happens in neutrophils, or macrophages, that has an effect on the pathogens. It's not as high impact and as fast as the dermal, but it is a cumulative ongoing process when you have ozone treatment. So these are the two areas where we can treat pathogens with ozone therapy. So we're just going to quickly review the common treatments that are around at the moment using medical ozone. There are the systemic treatments, so those are the treatments that involve blood. So I did mention before major autohemotherapy, where we take a small quantity of blood, maybe 50 mils of blood. We then put that in a special vacuumized glass container. Once the blood is in the glass container, we then introduce ozone gas to it. As soon as the ozone gas has made contact with the blood, it has reacted. That is gently mixed and then held over the head and then reinfused back into the body. And that is the basic overview of major autohemotherapy. We then have minor autohemotherapy, where we do this on a very small scale. So we will then take maybe 3 to 5 mils of blood out of the patient into a syringe. We will then use a very high dose concentration of ozone gas. And the reason why we want to do that is because we want to actually break up all the cells, because minor autohemotherapy is like an autoimmunogenic injection. It will produce and upregulate non-specific antigens to the body. So it actually helps towards the regulation of the immune system, but it has a much long-term effect, meaning I give you one ozone treatment dose, your initial dose will probably have maybe between 1 and 5 days effect, whereas one minor autohemotherapy can have an ongoing effect for up to 3 to 6 weeks. And this is really good for, usually for autoimmune indications, and hence why systemic. Then we have IV ozone saline infusions. This is where the Russian method of the very low dose comes into play, because it has the best outcome and expectations in terms of its methodology. And what we have is isotonic saline, which is 0.9% saline solution, sterile. We would, on average, the protocol would be a 200 ml volume of saline, and we would then infuse between 1 and 3 micrograms of medical grade ozone gas into the 200 mils of isotonic saline. There is a calculation involved here where we have to take into consideration the weight and the body mass of the individual. That is tied into the calculation. And then once the saturation process has completed in the saline, we can then re-infuse that back into the body. There's also the TEMPAS system. This is very much similar to the major autohemotherapy. The difference is that the machinery used, the system used, has the ability to automate to reintroduce blood back into the vacuumized container, and then also re-ozonate the blood. So the TEMPAS system usually uses something like 200 mils of blood, and then it will ozonate that 200 mils, and then it will be reinfused back in the body. And then once that's completed, it will then repeat the procedure again, and that will happen 10 times. And that's why we have the TEMPAS system. This is delivering actually much higher dosages of ozone into the body, medical grade ozone gas into the body. But the thing that we have with these particular methods of application, the ones that I've talked about so far, have had a great number, or a number of peer review and clinical peer review studies done on them. Up to 2018, there was a paper done that actually showed there was no peer review done up to 2018. And in the last 4 years, I have not been able to find a specific paper. I may be wrong, but there's a specific clinical paper, peer review paper, which actually goes into the breakdown of what TEMPAS is actually doing to the biological system and how it's actually benefiting, or what the beneficial outcomes are. I have no doubt that people are having a positive experience from TEMPAS, but it's still a relatively unknown in terms of scientific data is concerned. The next one is rectal insufflation. This is quite a popular method as a go-to method because it's very simple. It's much cheaper to apply, and it has a systemic effect of 95 to 98%, which is really pretty good. It's a systemic effect is in relationship to major autohemotherapy, which we would consider 100% systemic. There has been quite a sufficient study done when comparing rectal insufflation with major autohemotherapy, and the outcome and expectation between the two methods have the same parity. The only difference is that you may require an extra 2 or 4 treatments of rectal insufflation to get the same outcome and expectation that you would have when using major autohemotherapy. So rectal insufflation, is really, really useful technique application to use. As I said, very simple to apply. Not everybody will favor having a small catheter inserted into the rectum and into the colon, but those that are able to manage that, or those who are more used to the holistic health approach and have colonic hydrotherapy and so forth, this would not be a big step for them. But generally, in the holistic health approach, I tend to experience people very receptive to rectal insufflation as opposed to major autohemotherapy. When we look at the whole body dermal application, there's only one really treatment application that does that well, and that's the ozone steam sauna. The ozone steam sauna is like sitting in a cloud of ozone ozone gas with water, with steam. There is a synergy here between the ozone gas, medical grade ozone gas, and the steam, and that is that it humidifies the medical grade ozone gas, which then actually makes it more, it induces its ability to be absorbed far more readily into the skin. On top of that, what we have is vasodilation occurring and the pores of the skin opening more. This tends to help to fast track the medical grade ozone gas getting into the microcapillary system. And when it comes to, as a treatment, for me, this was a go-to treatment for detoxification and for doing very deep detoxifications indeed. So deep, that the patient would be dealing with quite severe detox reactions. However, we did talk about how we could use a treatment with ozone therapy to deal with free radical insult. Well, detoxification is no different. Detoxification at that level is a release of a range of toxins that break down into the blood that release free radicals. And therefore, if we use ozone therapy to increase the antioxidant enzyme system, specifically with using a modulating dose, then we would protect the body from these free radical insults through the detoxification process. And what happens is that the patient doesn't have any detox reactions at all. But for me, the ozone steam sauna is a great treatment for detoxification and a whole range of parameters. So the last area is for a local effect. I've put prolozone therapy here, which is mainly used for pain management as a local effect because it is mainly affecting the local area depending where you're injecting. But what is interesting about prolozone therapy in the field of ozone therapy is that it's actually very high impact treatment. And what I mean by that is that you have patients that are dealing with chronic pain, maybe for a decade, they have prolozone therapy, and within 2 or 3 minutes of having the prolozone therapy injection, they're immediately having a release from the pain. I mean, it's very fast reacting. It's so fast reacting sometimes that the body and the mind have trouble taking on what's actually happening, what's actually occurring. But with successions of treatment with prolozone, you do see a healing effect being applied at a local level. And prolozone therapy is a technique where you're using ozone gas, medical grade ozone gas injections with other injections, maybe vitamins, homeopaths, and membrane modulators, a bit like procaine, to help for modulation of exchange within the membrane, which would then fast track the medical grade ozone gas into the cells far more easier, and help the spread of ozone gas into the area to affect the inflammation from the pain. So prolozone therapy is fast acting. It's kind of like the rock star of ozone therapy. Whereas when you compare it with the systemic effects, it's an accumulative and it's an accumulative effect. So you need a series of treatments that are happening in a certain frequency to then have that desired effect with ozone therapy. But with prolozone, it's immediate. The other local effects are vaginal insufflation. This is where we can, similarly to rectal, but with vaginally, we can deal with conditions or symptoms within the vaginal walls. And this treatment has sometimes been mooted to become systemic, but you would need to do so many vaginal insufflations for ozone to become systemic. But the fact that you're doing vaginal insufflation, when you are putting ozone in this area, it's not just contained just in the vaginal cavity, it's going to go into the womb, into the fallopian tubes, the ovaries. It's going to spread into the lower level of the lymphatic system within the thighs and so forth. So in essence, it will become systemic, but it's not a go-to systemic treatment by any means. Limb bagging and cupping are all dermal treatments, and they're obviously very local effects. Whether you have psoriasis or eczema can be treated, or even burns. It can be treated through limb bagging and cupping. And the other area where a local effect can happen is in dentistry. And however, holistic dentistry may have a different view of that, whereas the philosophy of holistic dentistry is that the mouth and the meridians from the mouth, from the teeth, are all connected to the human body. But doing dental work with ozone can have this holistic impact in dentistry. And so we come towards the end now of the presentation, where we just close on the contraindications and contra-applications. So what we have here is a certain amount of indications that where we should avoid giving ozone therapy. So we have glucose 6-phosphate dehydrogenase deficiency. This is favism. This is actually a genetic disorder and would be known from the time of birth. So it's not something that a person would come to ozone therapy not knowing, generally most of the time. A patient that has favism does not have any toleration for ozone therapy and will make them ill, because they are missing certain enzymatic reactions that are, which would normally regulate the use of ozone therapy. But because this does not, they are deficient within this enzyme, this actually puts a block on ozone therapy having any use in their biological system. Acute hemolytic anemia, we don't want to induce more bleed outs or bleeding with the patient, so that's where that would be avoided. Hyperthyroidism, not hypo, but hyperthyroidism should be avoided if it's not controlled. If you're having a patient that is on medication and it's controlled, then you can treat the hyperthyroidism. The first trimester of pregnancy is usually a contraindication, and the very end stages, advanced stages of HIV going into AIDS, because there are certain other cardiovascular issues and hemolytic anemia issues that are associated in these stages, and hence why it should be avoided. When we come to the contra-applications, which type of methodology we should use or treatment we should use, there will be some, probably maybe, and some of these, some controversial aspects to this, but this is in line with what the Ozone European Association has put up. This is also in association to the Madrid Declaration, and it is looking at these methodologies that have a possible high impact, high risk assessment in delivering a therapeutic treatment. What is the outcome? What is the risk? Is the risk worth the outcome, or is it not? But there is a technique where you can, where people have had direct IV ozone gas injections. Remember, I mentioned that ozone is 95% oxygen and 5% ozone. So you have to be very careful if one was going to try this method. You'd have to be at a very slow rate, because you can induce an embolism, because you've got oxygen present in the ozone gas, right? And so the speed at which it is presented also the skill of the practitioner and able to deal with any adverse reaction as a result needs to be also be managed. It is a risk that can take place. So direct IV gas injections is forbidden in these associations and in the field of ozone therapy, particularly in Europe and in the UK, but in America may not. Inter-arterial injections are usually avoided because it's quite a complex procedure to get to the arterial area to inject, and also because the complications that comes along with that. And so it's normally associated when a person is in surgery and the surgeon has complete overview to control any complications that comes from an arterial injection here. So most clinics wouldn't be able to perform that in their clinic. Usually it's done in a surgical setting. And so the hyperbaric ozone infusions, once again, this is the 10-pass system or a 10-pass system, or you can have hyperbaric major autohemotherapy infusion. But once again, it's using pressure to increase the rate of infusion to be faster. And this, it just, because of the ozone gas mixture, and we have 95% oxygen, it's just looking at the risk factor and whether to say there could be additional complications that come as a result of reinfusing the blood too fast, because the oxygen doesn't suddenly react like ozone. It takes time. And just to as a little side note here, I mean, one of the things when you see major autohemotherapy or the 10-pass, one of the things that a practitioner may show you is that when you look at the blood and you then put the medical grade ozone gas into the blood and they mix it, then they will show you that after some time, maybe 10, 15 minutes, the blood starts to go bright red. Well, that's not because of ozone. That's because of the oxygen ozone mixture. That's the oxygen creating the bright redness, not the ozone. Okay, and that's a misinformation that ozone is making the blood bright red, and it's not. It is the reaction of the oxygen in the mixture, ozone gas mixture. But when you reinfuse this at a higher speed, this is where possible complications can occur, and hence why it is placed as a contraindication.